Due to a disastrous winter storm, Austin may have forgotten about COVID-19, but COVID-19 hasn't forgotten about us.
COVID-19 has proven to be a challenging foe. We've seen 2 and in some places 3 surges of this virus. And this should keep us from getting too complacent.
Adding insult to injury, last week's winter storm slowed down operations for Austin Public Health.
Testing operations, even receipt of laboratory reports from testing operations throughout the city and from the state health department kind of ceased during that time period.
Now the city is playing the catch-up game, logging data and doing some contact tracing.
We had staff that didn't have power, didn't have water, didn't have access to the internet, that were, going out to their cars, charging their laptops, computers, so we could continue to respond to the weather crisis, as well as continue to plan for our vaccine operations.
They believe the warming shelters also could have been a petri dish for the virus.
We most likely would anticipate seeing upticks over the next week, and so we are going to be looking very closely at that.
With things slowly getting back to normal post-winter storm, APH warns of another COVID surge being possible.
We're seeing resurgence of COVID-19 in areas that have already had high rates of infection, and these variants may lead to increased surges.
Governor Greg Abbott said Thursday he's looking at rolling back the statewide mask mandate. APH does not agree with this.
We are nowhere near herd immunity right now. It's not time to take off our masks.
Health officials say they administered 20,000 vaccines this week. Supply still is not lining up with demand, though. But APH is hoping to hear good news about another vaccine that could hit the market soon.
I'm very excited because Johnson & Johnson, their vaccine is going to the committee today for review. And if approved by the FDA, which is expected, then this will give us yet another vaccine and another 100 million doses